Good afternoon, everyone. Thank you so much for joining us. We have a lot of people registered, so I want to give everyone some time to get onto the webinar, and we'll begin momentarily. Good afternoon, everyone, and welcome to the Leadership Checkup Series, hosted by the National Council for Behavioral Health and the Association of State and Territorial Health Officials. Thank you so much for joining us. Before we get started, I'd like to quickly run through a few housekeeping notes. To access audio for today's presentation, you can listen through your computer speakers by clicking the Join with Computer Audio option in your Zoom window, or join by phone by dialing the number shown on your screen. Upon entering, you will be automatically muted. Please keep yourself muted for the duration of the webinar. We'll have time for Q&A at the end, so feel free to send your questions to the presenters using the Q&A feature at the bottom of your screen. You can also respond to any questions posed by the presenter in the chat box. And finally, today's webinar is being recorded and will be archived for future viewing on the National Council and ASTHO's websites. Today's webinar is titled Systemic Racism, Health Disparities, and COVID-19, Leading Through Complex Trauma with Resilience and Hope. Due to some unforeseen circumstances, Lisa Guroff, who has been leading and facilitating this webinar series, and Linda Henderson-Smith, one of our scheduled presenters, are unable to join us today. However, we've lined up two colleagues and subject matter experts to present with us today, Amy Roeschlein, Consultant for Trauma-Informed Services, and Erin Williams, Senior Director of Training and Technical Assistance for Substance Use here at the National Council. Amy has over 20 years of experience as a licensed clinician leading behavioral healthcare teams and developing and implementing programs in healthcare settings. She has published research and presented at national and international conferences on the subjects of interpersonal violence, trauma-informed care, compassion cultivation, and leadership and team-based healthcare. Amy completed her doctorate with a focus on innovating and creating large-scale social change through transdisciplinary training of mental health practitioners. Erin has over 16 years of experience providing training and technical assistance for behavioral health services, with an emphasis on substance use treatment and prevention, workforce development, and implementing evidence-based practices in clinical settings. He has written and contributed to numerous articles and reports on primary care and substance use treatment integration, workforce development of behavioral health providers, expert and implementation of medication-assisted treatment services. Before we begin, I'd like to take a quick moment to see what organizations are represented on today's webinar. So just gonna pull up that poll right now for you all. And I'll give everyone about 30 seconds or so to respond. Okay, great. I'm going to close the poll in 5, 4, 3, 2, and 1. And let's just share those results quickly and see. So we do have a pretty wide range, a lot of state and local health agencies, a lot of community behavioral health, some hospital and substance use disorder provider organizations, a good number of education facilities as well. Okay, that's great. We're really excited to have all of you here with us today. At this point, I'd like to turn it over to Ava Mason, Senior Director of Leadership and Learning at ASTHO, to provide us with some opening remarks. Ava?
Thank you so much, Casey. It is my great honor to welcome you to the session today. And ASTHO is so pleased to work with the National Council of Behavioral Health to provide this Leadership Checkup series as an opportunity for you to better understand the impact of the ongoing stress and anxiety from our current environment. It is our desire that by taking a few minutes out of your busy day, that you will be able to pause for some reflection, a little nourishment, and some practical ideas that will help you build and sustain resilience as you move forward. While we do not know how long we will be in the throes of the pandemic, or what additional emotional or psychological stresses may be coming our way, we really want to offer some tips to help you work through this time effectively so that you can all be the best you possible on the other side of COVID, and allow you to provide some encouragement and hope to those you are leading at the state, local, territorial, and federal level. You and your staff have truly been our genuine heroes through the last 8 months. And we at ASTHO and the National Council want to say thank you and just let you know how much we appreciate all that you do on the day-to-day basis to promote health and well-being. This session today will build on the previous topics that we've covered in the Leadership Checkup series. And this one actually will go deeper to really address the impacts and some solutions to the complex trauma that communities are facing. We hope that you leave with a few ways in which you can learn to lead through such complex trauma with resilience and with hope. So I look forward to learning along with you today during the session. And we really are excited to hear from our presenters. So I want to thank you for being here and turn it over to Amy to get us started. Amy?
Wonderful. Thank you so much for that wonderful welcome. Really excited and just honored to be here with everyone, and also looking forward to learning and growing with all of you as well. Before we begin, let's go ahead and just kind of have our touch point of recognizing why we're all here today. We're going to be exploring the history of complex trauma and how we really can start to create and sustain resilience both within ourselves and those who we serve with and who we serve for. On the next slide, I just want to take a moment for all of us to become present. And the best way to kind of let your bodies know that it's time to learn is to actually physically push your feet into the floor. Oftentimes these days we're so attached to our computers that we kind of forget that we actually have bodies that are linked to them. So let's go ahead and do that. And if you need to stretch or move, I encourage you to do so. If you need to, kind of move your head around on its axis, certainly can do that as well. Some brain-based learning advice. I suggest if you do have any other programs running on your computer at this time to perhaps switch them off. This is not only going to ensure the quality of the video and the audio of today's webinar, but it also can help encourage you to not multitask with emails and Twitter and texts and Facebook. So if you're here today, I'm going to imagine it's because you're actually interested in today's topic. And so I want to give you the chance to give yourself the gift of being present for the next hour. I encourage you to grab a pen, a piece of paper, or even open up a little tab on your computer to jot down any insights as they come up for you today. Memory and recall is really improved by the physical act of writing things down or typing them. Also, don't hesitate to grab yourself a water or a tea or whatever your preferred hydration method is and settle in with us for the next hour. Let's go ahead to the next slide. I know Lisa is wonderful at this practice, and so this is something I want to honor her with today, is to really give you all a moment to give yourself permission to either do something or feel something or not do over the next hour. So if you are brave enough and feel willing to, I'd love it if you want to share in the chat something that you can give yourself permission to do, give yourself a little permission slip. This can be something, if you'd like to share what you can, allow yourself to do to be present over the next hour, whether that's to turn your phone upside down or to, try to only focus on one screen at a time. And also, I hope today, if there is anything, if you notice any discomfort, to remind yourself that's kind of how we learn. And so really want to and am encouraged to hear all of the wonderful thoughts and experiences that you have with us over the next hour. On the next slide are a lot of the kind of thoughts that folks have been asking and sharing about in regards to complex trauma and what we can do in regards to trying to manage this. What can our agencies and our organizations do to both kind of acknowledge where we're at right now, and also to be productive and start to create more resiliency in our workforce. And part of this has to do with recognizing the strength that comes with the diversity of our own experiences. And so hopefully by the end of this next hour, you're going to have some practical tricks and tools that you can actually use with your teams to help you to start to implement the healing practice of resilience. The next slide is just a quick overview of what we're wanting to touch on today, particularly around what, for leaders, what we need to be thinking about so that we can help move this conversation forward. A lot of what we're going to be discussing, particularly at the end of the discussion today, is going to be focused on some of the habits that can create culture change within your organizations. So, and leaders as having power are the ones who are going to definitely need to exhibit those habits more than others. With that, I want to go ahead and transition it over to my wonderful colleague, Erin, to go ahead and get us started.
Erin, I think you're still muted.
Sorry about that. Thank you. Thank you, Amy, and thank all of you for being on the call today and helping to sort of ground us in the conversation today. And certainly, our colleagues, Linda and Lisa, all send their regards. Unfortunately, they couldn't be here today for this. So what I wanted to do today, at least with the time that I have on this webinar, is to try to begin to ground us in some of the terms and terminology. Certainly there's a lot happening in the world now. And what I think will be useful before we move into more conversation about, how do you begin to make these changes? How do you begin to kind of work through this? Is ground us in both the terms and in sort of what's happening. In some ways, I think, we need to explore, all the things that we're feeling, all the things that we're seeing, and sort of begin to put names and sort of definitions to them. To help ground us and really think about, what are solutions, what are strategies in order for us to move forward. So if you go to the next part of this slide here. So, given all the things that have been happening in the last 6 to 9 months, given all the things that were happening prior to that, given the work that we're doing, all of us being in some way, shape, or form in the helping profession, much of what we are experiencing can begin to seem a bit overwhelming. The analogy here is this concept of sort of trying to boil the ocean, that there's so many different things that are happening all at the same time and you have a lot of sort of, processes that are up in the air that you're juggling. Like, how do you begin to sort through it? How do you develop the resilience necessary to make the changes necessary to help people, which is kind of what we all got into this business for doing. So I just wanted to, one, start by sort of acknowledging, that kind of experience that really in some ways I think is a shared experience for all of us in this helping profession. So we go to the next slide. So part of what I wanted to, as I said, is sort of ground us in terms and talk about, what it really means when we're sort of discussing this idea of trauma. And, what does that mean sort of in the context of where we are now? And trauma, this is a definition from 2012 from SAMHSA, the Substance Abuse and Mental Health Services Administration, which is essentially the federal government's administration for behavioral health services, it really sort of oversees that. And they talk about this idea of trauma as being really individual trauma that results from either a particular event or a series of events or a set of circumstances that is experienced by an individual as overwhelming, life-changing, and has profound effects on individuals, psychological development, well-being, and also their physiological, social, and/or spiritual impact on them. One of the key elements to think about when we talk about this issue, this sort of idea of trauma, and it's not that a particular event is traumatic in and of itself. It is really about how the person experiences that particular event, which is why you see certain events maybe traumatic for one person, but not necessarily traumatic for another. It's the idea of, the event or set of circumstances and how the person experiences them. It can be a car accident. It can be a series of circumstances in one's life, that may happen, a robbery or some other thing. And those things really, could potentially be traumatic. Or for some folks, it's not necessarily as traumatic. So really the idea is, how was that set of circumstances or experience perceived by the person? And as, people in the helping profession, we need to be thinking about sort of how we can honor, that particular experience that people have as trauma. So if we go to the next slide. So when we step back and talk about this idea of trauma, many of us sort of think about trauma as this idea of, like I sort of stated, which is the car accidents or, the robbery, some of these sort of acute, sort of immediate sort of circumstances that have, a impact. Well, research has sort of shown, and I think particularly clearly, that there are other things that actually can have traumatic impact. And so we have sort of these things called intergenerational or historical trauma. And what we're really talking about there is sort of, cumulative and emotional psychological wounding over the lifespan and across generations, emanating from a massive group trauma or experience. So really the concept here is that there are things that have happened, particularly happening to a group of people or a subset of people that have lasting effects, that the people who experience those things pass them down through generations. And you have people who are experience that even though they didn't experience this sort of acute circumstance, are still affected by it generations later. Or, in some ways, it is an ongoing set of circumstances. That maybe there was some large event that sort of started it, but there's sort of an ongoing set of circumstances that still continue over the lifespan that sort of continue that trauma moving forward. So again, the idea here is that there are these sort of acute events that cause sort of sort of general sort of personal trauma, but there are these things that sort of span generations and sort of populations that also have lasting trauma and have lasting effects as well. And I think part of what we are beginning to experience or see, particularly in the last few months, is sort of the impact of those historical traumas, in ways that I think many of us had not experienced or seen before. So if we go to the next slide. So here are some of these sort of examples, I think, that are sort of really general and broad-based examples of things that might lead to what we call intergenerational or historical trauma, traumatic events. So you think about sort of genocide, slavery, thinking about pandemics, massacres. You think about, sort of social, policies, Jim Crow, discrimination, separate but equal. Also other things that sort of happen in sort of this sort of large scale way to have a substantive impact, not just on the people who experience them in an acute way, but on those generations that come after. So these are just some examples. And if you think about these examples, there are many people, across the country and across the globe who may be impacted by some of these significant traumatic events. And in some cases, again, as I said, some of these events, may be sort of continuing. If it's a subset of policies, these things may be sort of still sort of happening in some way, shape, or form, maybe not, in the same, impactful way, but still sort of having sort of that current sort of legacy as well. If we go to the next slide. All right, so here, this is actually, we're not going to show this now because it's a little bit long, but this is a very good YouTube video that talks very specifically about a particular historical trauma dealing with Native American populations. And then talks about how those historical traumas can lead to and sort of, move right into, what a lot of us see every day and sort of term as, microaggressions. And so when we think about, again, these intergenerational traumas, they have this lasting sort of impact and lead into sort of these everyday sort of experiences of, either trauma or, discrimination or, other things that really lead to the group that has been impacted. They have to sort of navigate this continuously day after day and day after day. And it leads to lots of other consequences. I'll talk a little bit later about some of the potential health consequences and other things that some of this leads into. So when we talk about the term sort of microaggression, we're talking about, everyday experience of discrimination, racism, daily sort of hassles or inequities that are targeted at individuals from diverse backgrounds or ethnic groups. Many of the health disparities, substance use, mental illness, all commonly linked to some experiences of historical trauma. And again, these microaggressions are sort of the current sort of manifestation of those things in some way. So if you get a chance, and when we send out these slides later, that video, I would highly recommend you guys take a look at it, as I think it's insightful in terms of how historical trauma sort of impact groups of people and how they sort of lead into microaggressions. So if we go to the next slide. All right, so when we think about the concepts around historical oppression and leading into historical trauma and leading into things like racial oppression as sort of a historical trauma, and these microaggressions, it really has a real lasting impact on individuals that are sort of targeted by these activities, really leading to a number of different things, sort of internalized devaluation, thinking about this idea of being sort of in some ways oblivious to what's happening, but certainly your emotions and sort of your reactivity shows that there's some sort of effect to some of these historical traumas. The assaulted sense of self. So these kind of reoccurring experiences that continuously sort of devalue who you are, in the space. One person sort of termed this the idea of being sort of invisible. So we're seeing repeated negative images related to your culture, or repeated stereotypical images related to your culture. Things that sort of are not true about the broad base of the culture, and certainly not true about you as an individual, leads you to the sort of feeling of either being sort of voiceless or even invisible in some ways, which I think, is where, that, sort of, topic of sort of the assaulted sense of self sort of comes into play. Internalized voicelessness, results and fuels internalized devaluation, and assault the sense of self. It impairs the ability to advocate for oneself. This idea that you're not being listened to, or feeling not listened to, or feeling as if the larger society does not include your perspective or interest at all. Again, it's sort of having this sort of recurrent experience, whether it's in meetings or in conferences or in different spaces in your life, can have an impact, and really can in some ways sort of stymie one's ability to really advocate for themselves in real sorts of ways. The wound of rage. So this is kind of an interesting one, to discuss. And here I want to read sort of the definition, but just touch on this a little bit. It's virtually impossible to be the depository of perpetual negative and debilitating messages and have one's sense of self assaulted without experiencing rage. It is indistinguishable from anger, which is an emotion connected to immediate experience. And so I think the key point there is really the idea of distinguishing between this concept of rage and anger. Being angry usually occurs, related to some sort of more acute activity or event. Rage is this accumulation of anger and sort of resentment over time, sort of the culmination, not just of a particular thing, but over a series of things that sort of boil up and boil over. It looks like rage, it feels like rage, but in some way, looks like anger, feels like anger, but in some ways, it's a much, much, much deeper sort of wound in that, that's kind of being expressed. The case of a nobody. So again, the sense of hopelessness or despair, really, focused on sort of the chronic and repeated experiences, and being, constantly sort of devalued within, a particular space. Again, back to the idea of having your sense of self, assaulted, the idea of, as I said, sort of feeling invisible within the space, that your voice, that your activity, and that your thought is sort of not, valued, where you are, or as a human in some ways. If we go to the next slide. Okay, yes, thank you. Yep. Yeah, so many of these things, and when we talk about historical trauma and talk about some of the traumatic events that are happening, you certainly can see some of this playing out over time. And I want to, sort of kind of preface this, sort of connect this in terms of the idea, the difference between that and sort of anxiety. So when we think about anxiety, sort of the stress related to certain particular events and things that may be happening in the larger society or in one's life, anxiety or trepidation about something is, a pretty normal sort of response to human stress. So when you think about, something like, the pandemic, people being anxious about, particular spaces or places, those are really normal sort of circumstances that also are happening and have impacts as well. Separate and distinct from, some of the sort of heightened senses of arousal may come from experiencing sort of historical trauma and other pieces, of this. So I think of one example really of being sort of thinking about the pandemic. I think I was out probably last weekend, and I went into a restaurant to get takeout, in which in the District of Columbia they're allowing that, and I hadn't realized that we had sort of transitioned to a different point in terms of our guidelines, and the restaurant was quite full, and I had a sort of sense of anxiety about being there, related to that, and it just was something that had been several months since I had seen that. And I was like, wait a minute, okay, what's happening here? So I had that heightened arousal, that sense of anxiety that many people experience, over time. That sort of, calmed down for me. It just had been a while since I'd, been in a room with that many folks, given all that's happened, in the country. So just thinking about, those sort of normal subsets of anxiety being a part of this work as well, being a part of what's happening, that you're seeing from, coworkers, from others as well, is sort of in the mix of this conversation. Next slide. You want to go ahead and just show the whole, yep, okay. And so when we think about, the idea of sort of what's happening in this concept, today of, of sort of complex trauma, right? And intersectionality, we'll talk about in just a second. Really, I mean, there's a lot there that we can sort of unpack. And there's a lot, as I talked about earlier, this concept of sort of, boiling the ocean. There's a lot to unpack there as we think about this. So not only do we have the pandemic, but we certainly have what some people would call another pandemic of, sort of racial oppression and racial injustice. And so with that, it's hard not to, as we think about this, see the connection between, what has been happening in terms of racial injustice, and the intergenerational trauma, within this country, particularly related to Black and Brown people and some of the policies that were implemented over time. So if you think about all of the anxiety related to the pandemic, all of the intergenerational trauma, related to racial injustice, you really have a complex web of, things that may be impacting and having a larger impact on people's health and well-being, and really sort of a lot to begin thinking about navigating. If we go to the next slide. Again, just kind of these kind of depictions of that sort of unrest and sort of fight for racial justice that we're seeing. So here, what I wanted to talk about is really sort of leading in, those slides are sort of leading into this conversation about this concept of intersectionality. And we're going to show this video. It's only about 3 minutes. It talks about really what intersectionality is and sort of how it connects with, what's happening here in a larger context. So if we can go ahead and play the video now.
It looks like the audio
looks like the audio is not working.
Give me just one moment and see if I can get that fixed for you.
Hey, Betsy. What the long face?
Hi, Dave. I just got off the phone with my wife. She is having issues at work still.
Oh no. What's happening?
Well, as I'm sure you know, my wife is Hispanic. She moved to the United States from the Dominican Republic many years ago. Even though she's lived in the U.S. for many years, people are sometimes still hard on her because of her accent.
Wow. Is that why there's issues at work?
Well, that's one of the reasons. Her boss seems to be passing her up for opportunities, and she's just had it. She thinks her boss doesn't like her accent, and after he found out that she was married to a woman, the tension at work got even higher. I feel so awful for her. I wish I knew how to help.
Has she talked to Human Resources about her concerns?
We have discussed that, and I think it will be the next step. It's just tough for her in this situation because she isn't sure where his hostility is coming from.
What do you mean by that?
Have you heard about the theory of intersectionality?
No, actually. What is that?
Intersectionality is the interconnected nature of social categorizations such as race, class, and gender as they apply to a given individual or group, regarded as creating overlapping and interdependent systems of discrimination or disadvantage.
Could you explain that a little more simply?
Sorry about that. Basically, it's the idea that we are not just one identity. We have many parts of us. You, myself, and my wife are all part of the LGBTQ community, right?
Yes, and my boyfriend too.
Yeah, exactly. Except we all four belong to other groups that make us who we are. Unfortunately, some of us are part of other minority groups that are also discriminated against. My wife, for example, is a Hispanic, lesbian woman. These different points of her intersect, and it creates double and even triple discrimination at times.
Geez, Betsy, I hadn't even thought about that before.
That's all right, Dave. We have spent so much time focusing on segmented groups to promote diversity, but it goes so far beyond that. When my wife, or anyone else that belongs to multiple minority groups, feels discriminated against, it is difficult to understand the cause or even how to approach the situation. My wife, for example, isn't sure if she is experiencing homophobia, sexism, or racism, or even a combination.
Wow, that is really sad when you think about it. Intersectionality isn't something I'd ever considered before, but you're right. Even though we're all a part of the LGBTQ community, none of us experience life in the same way.
Exactly, Dave. Intersectionality is the belief that oppressions are interlinked and cannot be solved alone. This is the pivot of diversity. The more we take the time to get to know and understand people from all walks of life and stop trying to fit ourselves and others into one category, the better off we will be as a society.
I agree, Betsy. I hope things get better for your wife. We've made great strides in universal acceptance, but there's still a long way to go.
Thank you, Dave. I hope so too, and I definitely agree. It is important to truly listen to others and examine our own privileges. I hope we can find a solution with her boss and for anyone else experiencing these issues, both within the workplace and out.
Thank you for that. Yes. So I think, as we sort of think about sort of an impact, sort of all the things that may be happening, we do want to talk a lot about this issue of intersectionality as well. Having these sort of, being sort of connected to multiple groups that may be experiencing multiple different, issues around sort of race discrimination or marginalization. And how that impacts, a lot of sort of what's happening with regard to, the sort of broader society, and then how you provide those services. So I want to move this into sort of the kind of the why and sort of what's happening as it relates to, generally health. So if we think about the impact of trauma on marginalized populations or minority populations and social determinants, there's a lot of data that talks about, people from marginalized populations are exposed to higher rates of trauma, less likely to receive adequate mental health care due to service barriers. We looked at some of the data there. They talk about a number of barriers such as limited insurance coverage, logistical barriers, linguistic and cultural barriers. If you go to the next slide. Other things that come up, within that realm of sort of barriers, particularly pursuing mental health care, some structural barriers, prejudice and discrimination directly, concerns over the effectiveness of care. There are a number of things in which, some of these larger issues, going back to historical and intergenerational trauma, have an impact. But also, particularly being part of marginalized populations, there are other structural barriers that may impact your ability to access care, the quality of that care, and sort of the long-term, benefits of that care are as well. So we go to the next slide. We think about exposure to trauma. So we have some data that really talks about this and sort of how prevalent the exposure to trauma is. So the 2011 data talks about this. Asian, Black men, Hispanic women have higher risk of war-related traumatic events. Blacks and Latinos have higher risk of child maltreatment, witnessing domestic violence. Whites are more likely to have trauma, learn of trauma to someone close to them, and learn of unexpected death. So really thinking about, there are a number of different groups. Pretty much all groups have some sort of risk as it relates to this issue of trauma. So as we think about being in the helping profession, exploring trauma, what happened to people, really can be a critical part of helping with the healing process. Next slide. All right, so we talk a little bit more just about, again, like in in the way that sort of anxiety, which is a part of this, is sort of normal. Certainly sort of what we call the survival response mode. So, fight, flight, or freeze, as people talk about these things, these are actually normal sort of responses to stimuli or to stressors, within the environment, and that people sort of engage in. And is a normal part of the response, but really something that, as we think about stress and think about what's happening with people in certain circumstances, that we should talk about as well. Sort of how people, maybe may or may not be hardwired to engage in one versus the other. But certainly, again, this is a normal part of the, response process. Go to the next slide. All right, so when we again talk about this sort of the long-term effects of trauma, trauma can also shape our beliefs about the world, how we see things in large ways. Really thinking about what the world looks like, particularly if you have had sort of traumatic experiences. And this slide really talks about this concept about we don't see things the way they are. Very often we see things the way we are. And so it talks about the impact of how trauma can really affect how people see the world, whether or not you see the world as being or people in the world as being sort of threats, or friend or foe. Really a way to consider again how trauma begins to shape one's belief system about the world, even spirituality, even about identity, who they are and sort of who they need to be within the world, to stay safe. Next slide. So when we think about sort of trauma, there are also these sort of internal and environmental triggers. For many people, the external triggers such as smells, sound, sight, touch, and taste. These things, when linked to potentially negative emotions, can bring back reminders of a traumatic event. Maybe there was an incident at a hot dog stand where there was a violent event or something. So the smell of hot dogs or that may remind people of a traumatic event. So trauma can really even have an impact there, particularly thinking about sort of triggers in terms of behavioral triggers. So you want to think about that and consider it as you begin to continue this work of helping people and moving people forward. Next slide. So here, just kind of to encapsulate a lot of the sort of stressors of the day. We talked a little bit about this earlier, but just thinking about it very broadly and about how all of this is kind of in some ways interconnected. Now this idea of social or physical distancing, even now, with all of the use of things like Zoom and technology, while these are sort of great ways to bring people together and bring sort of technology and information to the masses. They also technologies that, for good reasons in some way, keep us socially distant. So we don't have the same sort of interpersonal interactions that we once had, the sort of physical connection that people, who certainly need that kind of physical connection, that is more limited now. Certainly there are people who are worried about their jobs and financial constraints and stress, the economy and closing of businesses and workers being laid off. The unknown, sort of how long will this last? How long is this going to continue? And not really having much sort of a locus of control over that certainly is a part of that stress. The gloom and doom, sort of the news cycle. And, looking at social media and how, in lots of ways, there's a lot of sort of negative content one way or the other there in terms of, bad news versus good news. A lot of the technology we have now for those that are able to work or those that are, essential workers, you're probably working quite a lot right now. So, lack of sort of vacation time. Where are you going to go? How would you, get there? Chronic health problems. We see a number of chronic health conditions that have worsened. We see a number of, things like increased substance use and mental illness. We know from SAMHSA and their data that their crisis line has received a significant fold increase in terms of people who are reaching out. We see the increase in prescription-related overdoses look like they're increasing again from 2018 numbers. So a lot of things in that space. Constant multitasking, sort of merged roles. If you're like many of us, again, who are working from home, you're probably working on several different tasks all at the same time. So there are a number of different stressors that have been brought about by sort of what's happening now. And then also, again, certainly don't want to lose that is, some of the social unrest and sort of the fight for social justice, which is, I think, a part of all of this sort of mix of circumstances as well. Next slide. All right, so I'm going to stop here, and Amy's going to talk about, simple versus complex traumas and a number of activities, in which we can, think about how we can move forward and really address these for the people that we serve.
Perfect. Thank you, Aaron, so much for giving such a detailed look at this. And I know we've only got 15 minutes left, so I'm going to dance over a few of these and just really try to touch some of the most important areas. The first slide that I want to look at, let's go ahead and dance over the next slide and jump into the some of the warning signs and stress and burnout. We can stop right here. This is perfect. So I think when we're thinking about resilience, given everything that Aaron has mentioned, the reality is that our work is exhilarating and stressful, and oftentimes the expectations and the uncertainties that are often continuous occur in these ever increasing paces, and sometimes they're contradictory. And so what happens is that we can start to feel this pressure where we feel as though we lack the capacity to meet others' expectations, or maybe even more so the ones that we have for ourselves, because we think we should be able to make some of these changes or protect ourselves in certain ways. And what ends up happening is that we can become apathetic and avoidant and sometimes even angry, which can lead us to start to lose the joy of the work that we do. Oftentimes in the efforts that we're doing to focus on building resilience in those that we serve and in the communities that we work with, we really are charged with the examination of our own capacity, our personal and professional capacities to model what we strive to build. And so on the next slide, if we can jump over there, I think that this is looking at it from a deeper perspective, which is, how can we ensure as leaders that the work demands and the pressures are matched to knowledge, abilities, and needs? How can we make sure that we're giving our supervisees, as well as our supervisors, our colleagues, support? How can we share, and I know Lisa probably has touched on this numerous times with you all, the control over work processes, and how can we start to change the culture of our work environments? And so a lot of this is where we're trying to integrate a lot of the trauma-informed approaches that we currently have, so that we can not only prevent harm, but we can start to instill and create healing. Next slide. One way to start with this is, unfortunately for some of us, who are really good about speaking about how important it is, but really bad about doing it ourselves, is starting internally. So if we're really honestly looking at building resilience, we have to look at how our own self-care, how we can have more compassion. People in the helping profession, I think, tend to have enormous loads and amounts of compassion for others, but with ourselves, we're often pretty hard on ourselves. So how can we begin to engage in meaningful work with ourselves and do that hard work and not only assume good intent in others, but start to assume good intent within ourselves. So let's go ahead and jump in. Next slide is kind of our deep dive into culture and creating compassionate cultures to promote resilience. Let's go ahead and dance to the next slide, which is focusing on, why is this important? Erin, you touched on intersectionality and how important it is for us to recognize all of the overlapping identities that we carry with us, and also take a stance of cultural humility. And so on the next slide, when we're starting to think about cultural humility, this is a wheel that comes from, where I spent many years of my career in academia. And what is missing on this slide is the social historical dimensions that are a vital component of identity formation. And so when we're thinking about those that we work with and even ourselves, we want to start to take a culturally humble stance. The next slide starts to break it down for us. My hope is that this is a concept that many of you are familiar with. This involves a commitment to self-evaluation and self-critique, what we call in Buddhist psychology, the beginner's mindset, recognizing that the moment that we consider ourselves experts, that we're kind of done learning and growing. The truth is that we're never finished. We never arrive at a point and think, aha, we're done. Therefore, we have to be humble and flexible, be bold enough to look at ourselves critically and desire to learn more. And if we can, start to actually try to fix power imbalances where none should exist. Let's go ahead, and I'm going to give you all a gift today. We've got some handouts that will help you to actually be curious about taking culturally humble approaches that you can look both for yourselves and scales that you can use within your organizations. Now we're looking at a slide on implicit bias. I'm not going to go too deep into this. What I do want to say is if you have a brain, you have bias. The architecture of the brain requires it. So no matter how much, if I spent the next 2 hours educating you all on all the different pieces of implicit bias, most of us, even scholars who, get their doctorates in this stuff, they're not able to notice their own bias in the moment. And it's not because of lack of awareness or motivation to do so. It's just the way that our brains work. It's the architecture of our brains. It's a cognitive bottleneck. So only around 20% of the time with sustained effort can you actually recognize bias in the moment. It's just like how we can't hear above certain frequencies and we can't run 100 miles an hour. Next slide. Great. So then, what are we supposed to do? The right way for us to start to tackle bias is to, hopefully have an awareness of bias. And I know that many of us over the past year or two have really had more and more implicit bias trainings that focus on awareness of bias, but that actually, the science of it doesn't hold up. It actually doesn't do that much work in actually mitigating bias. So where we can start to do this is to do it as teams. The team perspective is where we can make these changes. Teams of people pausing and saying, hey, let's just make sure that we're not being biased right here. So starting to build habits in your families, in your workplaces, that start to teach you how to pause and say, I wonder if there is such and such a bias here. Wondering and actually saying out loud when you're having your staff meetings or even in email, I wonder if we've accidentally been subject to a bias here. We want to be cautious because people can get really defensive because they can feel shamed when we're talking about biases. And so we want to be positive about it, that, hey, this is the way our brains work. This is very normal. And so how can we lean into each other and pose questions as possibilities? You know, this is a really important decision that we're making. Is it worth checking to see if there might be some bias here? This is something that I feel like we might want to explore. The next slide is focused on this idea of universal expectations. So this is one way to be culturally humble, to start to exercise these types of universal expectations. We want to presume that those we serve with and those that we serve likely have a history of complex traumatic stress. And if we can exercise universal expectations by creating systems of care that are trauma informed. Remember, when we're thinking about complex trauma, this is something that occurs within relationships. And so where the healing needs to take place is within relationships. And I think oftentimes leaders are very focused on the data. We're focused on the goals that we have, productivity, things like that. And sometimes we forget the importance of the people. And so the more that we can kind of recognize and acknowledge and attend to relationships in the workplace and amongst the workforce, the better we can be at starting to promote resilience. Next slide looks at self-care within an organizational culture. Working on organizations' wellness is imperative to increasing compassion, resilience, and wellness of each employee. So we've also are giving you a handout that you'll be getting today that is going to include some ideas and curiosity around your own organizational self-care mechanisms. What are ways that you can provide this within the workplace? You know, the more that we can try to create and maintain healthy employees and a healthy system, the more the better we know that we're going to be doing at our jobs, and the more people are going to want to come to work and to stay working there. Next slide is kind of taking that idea even further. So, you know, compassion, resilience, this is an approach to building resilience in both individuals and within organizations. The more that we can acknowledge and support concern for others and for well-being, the more that we can go beyond feeling with another person to actually desiring to diminish or eliminate the distress of those that we work with. Let's go ahead and jump to the next slide. If you get nothing else from today, I think the more that we can try to have baseline a compassionate culture for everyone, the more involvement of leadership, the more that you can do. But baseline, really trying to find ways to take care of ourselves and then model that with each other. Let's go ahead and keep going. I know a lot of people, we're going to be closing soon. Let's go on to the next slide and next slide. In regards to community response, this is something that's incredibly important for us to create safe places and to do the work. And I think that's something that, you know, we're hearing a lot of these days, but actually starting out as an organization to question, what does that mean internally for ourselves? The next slide actually breaks it down into, and there's a link to where we pulled the information from. If we can go to, yeah, perfect, healing hidden wounds. So these are some of the ways that organizations have actually looked at, you know, how can we do the work? How can we start to affirm, create space for diversity and race? And, you know, diversity is something that's quite simple as far as data goes, but the real work begins with creating engaging environments where not only do we want you here, but we value you and we need you to be here. And that we really feel that in incredible ways, recognizing that without that having inclusion and engagement of the workforce, we're just going to be kind of a revolving door of losing folks. Next slide. All right, now we're going to get to the resources. So as I said before, we're going to be giving you a cultural humility scale. We're going to be giving you a assessment, a self-care organizational assessment, and we're going to give you an equity, a climate assessment to really take a look organizationally and see, you know, how are we doing it, addressing complex trauma within this organization, and what can we do to move this forward. I want to remind you all that this is, and Aaron, please come in and join me because I know we're wrapping up. I think that it's important to remember that this is a marathon. You know, this is something we went through a ton of information. This is something that takes time. And so, you know, to pace yourselves, to recognize, as Aaron said, about boiling the ocean, that we want to kind of start with ourselves and then move forward. What am I missing, Aaron? Yeah, what else can we say as we close?
No, I think you wrapped it up, you know, very perfectly. And one of the things I did want to say about some of the scales that you were talking about, implicit bias and sort of the concepts around diversity, equity, and inclusion or engagement, is that you know, that diversity and inclusion helps to mitigate some of that implicit bias by making sure that you have diverse voices in the room and that they are able to sort of be their authentic selves in the room and really contribute to conversation. So just as a thought about some of that work. But no, I think it's you know, these resources are excellent. We encourage you to take a look at them and see how you can implement them within your organization. And yes, and give yourself some grace and engage in that self-care to help build, you know, your resilience. You know, we all are living through some very interesting times now, and really, you know, that's of critical importance as we move forward.
Great. Yeah, and please don't hesitate to reach out to us as well. Like if you do try some of the resources that we're giving today and you find like, oh my goodness, that wasn't a good match, we'd love to hear that as well, because we also want to have that be culturally humble and recognize that we don't have all the answers. And so you know, this is something that we're all growing and learning together. Thank you again for the wonderful words in the chat. Take good care of yourselves. You know, this is hard work, right? So hope that everyone stays safe and takes care of each other. And Aaron, thank you for doing this with me today.
Oh, it's my pleasure. Always good to work with you on these.
All right, take care, everybody. Is there anything else that we're missing to say?
No, thank you both so much for your presentation. There's been a lot of really positive feedback, and we really appreciate your expertise and your time. My colleague Samara will be putting the link to register for the final webinar in this series, which will take place on October 22nd. And as a reminder to everyone, you'll receive the recording and slides in a follow-up email after this webinar. It'll also include all of the links to the resources we've been putting in the chat, as well as the handouts that we've mentioned. So thank you everyone so much for joining us today, and have a great rest of your day and week.
All right, see you guys.